Listening to what Representative Schock said, saying that we as young people like choices, he also said that under the president's plan, Obama, in very short order, will move towards a one-size-fits-all single-payer system. And because of this, we have rejected Obama's plan. Yet every time I see people who listen to the president say what he will do and what he will not do, his support grows. Yes, we as young people do like choices, but I disagree that we as young adults have rejected the choice of a public option for healthcare. And just saying that Representative Schock, as the youngest member of Congress, is therefore the spokesman of the youth generation is a huge assumption. He may be our highest public figure in our age group. However, he does not represent the majority of the people I know in this age group. I disagree with Representative Schock because President Obama has never said that he wants a one-size-fits-all single-payer system, nor has he ever said that's what he's moving towards or what he wants to do. This is another assumption by Representative Schock. He is battling something that is not there based on his own assumption as fact, and for that he is wrong, and I disagree with him. President Obama has said he has no plan to move toward a strong public option, sorry about that. He has said we need a strong public option to pick up those who fall through the cracks and to help them get back on their feet. He wanted to act quickly to pass the public plan through because we were losing so many people, because people were losing their jobs and the insurance that go with them. More people are losing their insurance every day. The only truth in what Representative Schock said was that young people, my generation, our generation, do like choices. I believe it's a privilege that we have so many choices. And I want to include the choice to have a quality public option for healthcare. I also want the choice to move out of that public option into a private one for the better care they say they provide. However, right now, I want the choice to be on a public option, but I don't want to be on one forever. The public option should be set up to catch people that slip through the cracks in the current system. And at the same time, if we can save money on taxes by paying for preventative care of a couple $100s a year per person versus paying what we currently do for emergency care of a couple $1,000s a visit, it should be worth our effort. This problem extends even beyond the uninsured, the people who are underinsured. If you have a cap of $500,000 on medical bills, that'll cover most problems, but cancers can still cost up to $3, $4, $8 million. Even with insurance, a person could hit their ceiling and then be left on their own for the remainder. The cost of healthcare are very unpredictable and could range from $200 one year to $4 million the next year, regardless of how healthy we feel right now. The public option plan would give everyone a better average and better average quality at a cheaper cost while keeping the choice for those who wish to go to private. If this is what's being proposed, why are private companies afraid of competition? This is what the public option, based on what I've read, is its main plan. However, for me now, as I'm 24 and now out of college, if I go back on a private plan, I have a gap in my health care. I'm not alone with this. A growing proportion of people in our age group are getting a gap in health care. We finish school, we move, a parent's plan would lapse. And there's lots of fine print about how to transfer it or extend it. And now with this lapse, I've become uninsured. If I get sick or need care, I need to go to an emergency room. I don't want to, but that's the only choice I have. If I ever get on a private plan again, and even if I make my payments every year for a few years, or every month for a few years, I could still possibly get denied denied coverage based on a pre-existing condition I had during a gap in my health insurance. Even just a slight chance of that is too much of a gamble for me. And it seems like it makes me wonder, who are the laws protecting, me as a citizen or a larger company? Right now, I don't have any choice. Since insurance companies are private and they can cover who they want, who will keep them honest for me? I don't want to have to face down medical bills I thought I had insurance for, only to find out I'm denied because I'm told of a pre-existing condition, like Brooke is. That possibility scares me, and it will continue to happen unless we act now. I feel the choice for me is a public option that won't lock me or anyone out based on a pre-existing condition or based on having a gap in healthcare. I'm not alone in this opinion. With the downturn in this economy, we follow an increasing number of people going out without insurance, so more and more people are being affected every day. As it grows beyond capacity, who will these people turn to for help if private insurance companies won't? If the government bailouts have taught us anything, it's that we don't want health insurance companies asking for a bailout while somebody's life is in a balance. We need a public option on this. My last note is that we are the generation that I hear on the news, them saying we need to think about the burden we're placing on our children. We are your children, and we are also a majority of the people who stood for Obama when he said he wants a public option. We want to be able to get our care and not have people try to protect us from paying it. That's all I thought. Thank you.